Romeo Busiku. Our next segment is the press review, where we get to dissect this, the contents of the Daily Monitor. Yes, let me take a look at some of the conversations that we have here. The president is advising all Ugandans to stay home. Well, that is the directive. And the head of state advised Ugandans to use private means of transport to their workplaces and avoid public transport if they can, as the country reports its first case of the coronavirus. Now, in response to this, I have the Uganda Medical Association's president, Dr. Richard Idro, via Skype, is going to be talking to us to let us know and give us more information with regards to the coronavirus. A very good morning, Mr. Idro. If you can hear me, what's the latest with regards to the coronavirus? We do understand that 84 people were with the isolated man that was at Entebbe International Airport, the 36-year-old.
Yes.
But 84 of those passengers were let go. How serious is that situation, and how is the government going to track down those 84 people? Dr. Richard Idre, very good morning. Thank you for joining us. But then how will the government track down the 84 people that were with this 36-year-old male that was in Chibuli?
Good morning, viewers of NTV. Every time somebody travels, you have a passport, and at immigration, there's a manifest which is available. So the details of all the 84 people are available to government, and contact has already been made with a number of these people. So tracing them is not a very difficult thing to do.
Mr. Idro, I'm sure you can hear me now. One man aboard the Ethiopian Airlines was confirmed to have the coronavirus. If we are to go by the behavior of the virus, we would think right now that he infected the 84, likely. He might have infected the 84 people that were on board of the Ethiopian Airlines. Are we dealing with a wider spread of the coronavirus at this interim?
No, I would like us to not to fear excessively or to spread panic. The way the virus spreads, we have already described in many of our press briefings and to the public, and the president has been very clear with this. It is droplet infection. So somebody sneezes, and these droplets usually travel at most a meter. So the people who may be at most risk will be people who were just within the same cabin, and most likely the ones who were sitting next to this particular person. Secondly, this person was also not coughing. He had fever. So the most likely, if there is any risk of spread, it will be people who will have been in direct contact with him. And then thirdly, the airplanes have an extraction system in which extracts particulate matter, so that things which are circulating in air get extracted. So it is very unlikely that there was a wider spread of the virus in the plane. The majority of these 84 people will be okay. It will just be a few individuals who might be at risk, and all of them are under surveillance.
Dr. Richard Idro, do we have the capacity as Uganda to actually carry out tests on a countrywide scale?
Absolutely. The Ministry of Health and the health workers in the country have been preparing for this for quite a long time. You are aware that it's now almost 3 months that this outbreak occurred in China. And Uganda has a very wide trade network with China. We have been having people going to China. So the likelihood that this could be imported into the country was high. Since then, Ministry of Health has set up testing facilities in a high-level laboratory at the Uganda Virus Research Institute, and we have millions of test materials at UVRI, and a system has been set for this testing. So around the country, we have 100 hubs which can collect samples from wherever a possible case is, or a potential or a suspected case is reported. As a recommendation, we say if you suspect that you may have symptoms, you make a call, and our surveillance units will go and take the sample and deliver to one of these 100 hubs. And overnight, these samples will be tracked to the Uganda Virus Research Institute, and it will be tested. And in the UVRI, it will take less than 4 hours, and the test results will be available.
Dr. Richard, now I do understand that the country has only 55 ICU beds. In Iran, a country that had almost 110,000 ICU beds, they were still grappling with the number of people that were coming in to be tested and to be treated of the COVID-19. Now, in your opinion, do we have enough equipment or resources to combat a widespread contagion?
We have seen the example from the developed countries, especially Italy. And this is a very resource-intensive, resource-using disease. In this, as a nation, our primary action is prevention, and we have been doing everything to prevent this disease, so that we do not see the kind of situations which we have seen in the West. Beyond that, it will be impossible for us to contain it. And that is why we want to re-echo the message of the president yesterday. Do not undertake unnecessary travel. Stay at home. We do not want very many people to get exposed to this disease. Right now, we are making arrangements in a number of hospitals. The hospitals right now with some degree of readiness is Entebbe Grade B Hospital, where the case is isolated. We are, the Mulago Specialized Hospital is almost ready to receive cases in case they appear, and then Naguru. And we are making arrangements in all the regional referral hospitals in this country. There are 19 of them. And this morning in the Ministry of Health, the Case Management Committee and the National Task Force is meeting to try to map up. Over the course of last week, we had mapped up what kind of resources we need, both human and supplies. We have spent quite a bit of time to do this. And now what is left is to procure some of this and put them in place. Later during the course of this week, an advert will go out to try to get additional health workers who can go to these regional referral hospitals. The situation which we are looking at is that if this disease attacks about 0.1% of the population in Uganda, with 40 million people, that will be about 400,000. But usually up to 80% of them will be asymptomatic. They may get the disease, but they may not develop symptoms. Symptoms that's fever, cough will develop in about 20%, and only 5% or so of this will need critical care or high dependency care. But still, this will be large numbers, way beyond what we have. So we want to avoid all these kind of scenarios. And yesterday, the National Governing Council of the Uganda Medical Association also met, so that as health workers in this country, that we prepare ourselves. We're examining the strengths and the different things in our health units. And one of the things which we are considering and which we shall discuss later today with the Ministry of Health is how do we avoid crowding in hospitals. The Ministry of Health will be making this communication and will either later today or tomorrow also hold a press conference and to the effect of crowding in hospitals, so that people with mild conditions or elective conditions do not necessarily need to appear in hospital, so that one, we conserve resources, two, we conserve energies of the health workers. You realize that really this is a disease which requires a lot of concentration for the health workers we have, so that they are left attentive and with no chances for making mistakes. And lastly, that we allow spacing in the hospital so that there is no unnecessary crowding in the in the different hospitals.
Dr. Richard Idro, you hinted on a very, very crucial factor, that is the asymptomatic people that might be carrying the virus, but they do not exhibit any symptoms. In that way, they get to spread the contagion very, very easily, and some people, unsuspecting citizens, get infected in the long run. Can you please help us expound more on that issue of asymptomatic victims in that regard? And they also on another issue of oral fecal transmission. We would also to get more information on that.
Mr. Busiko, one of the things is that this is a very new virus in which we are dealing with. It's less than 3 months, and a lot of the information we are sharing, we have learned it in the last, I would say, 10, 11 weeks of the spread of this epidemic. Now, one thing which appears, what we have learned from the neighbors is that if of the 100 people who get infected, 80% or 80 out of 100, their body's immunity is able to overcome this disease. It fights the disease, controls it, and the disease does not develop symptoms. You do not develop fever, you do not develop a cold, you do not develop a cough. The disease is contained within your body. And the majority of these people do not necessarily spread the disease. Now, about orophycal spread, and we still do not have complete information, but it will appear that when you cough, some of the people who cough may swallow part of the cough. The other thing is that, you see, the disease affects the nasal cavities. It is in the throat, and we are touching our mouth. And by making contact with this, even if one is not coughing, you are more likely to touch surfaces and leave it on those surfaces, and then somebody else touches it and may contract the disease if they touch their softer parts of the face. And that is, the oral is the mouth. So even if I was not coughing and I had the virus and I touched my mouth and then I touched the surface like a table, a doorknob, and I may spread it.
In the interim, what can our citizens do to protect themselves from contracting the COVID-19?
Yes. So the message is still the same. I would like to thank the president for having been very clear and consistent with the last two press conferences. That one, let us stay home and do not move unnecessarily. Let's not go to crowding places. The initiatives to close places which are crowded, bars, churches, the schools, our children have all come home. If have come home is really appropriate. Two, let us continue washing our hands with all good soap and water is adequate. Where you cannot use sanitizers, it should have more than 60% alcohol. There are a few other things which we have noticed in the last few days. And where you go into hotels or supermarkets, we see, and even petrol stations, there are people wearing, the guards are wearing gloves and checking items. Now, that is a potential risk, because if they touch bags of ladies, if they touch it, they can transfer it to the next person and to the next car. In between, the hands should be sanitized. It's really important that one happens. The doorknobs, and in places where there are biometrics, also those areas should be checked. Remember, if you have to cough, please use a tissue or a hanky. The hanky should be washed every day and ironed in the evening. But if this should happen suddenly, please sneeze into your within the elbows. Remember not to touch your face, and please avoid areas which are crowded, and we move away from them. Let us stay at home.
Idro, the president of Uganda Medical Association, many thanks for having made the time to speak to us. You've been very kind.
Thank you very much.
Well, you're still at NTV. You've heard it for yourself from the president of Uganda Medical Association, Please, if you do not have any important business in